Welcome back. I've been off of this channel for a while, almost like 5 months now. I've been pretty busy. I started this another YouTube channel with doing my cousin. It's doing pretty well, so I was focused on that channel. This one, it's not doing as well, but granted, I didn't put as many effort into it. So hopefully, I get to 1,000 followers. The reason I want to get to 1,000 followers on here is to so please follow me on Instagram, TikTok, and all of that. All right, but the reason I want to get to 1,000, I'm going to switch to a little business as well, like a nursing business. I started this IV hydration business. I'm going to give you kind of a scope of how I started it. So I'm going to tell you about how I started my business, why I needed to start my business, and whatnot. Also talking about the profits I gain, or even the losses, the months I do well, the months I do bad in. I'm really trying to give you like a real close insight so I can kind of just motivate other people to start their own business. Usually people get paid for this, right? I almost bought a prescription to pay for this business that will give me $3,000. I have to pay $3,000 and they'll give me everything I need to know. I'm going to give you all the information for free. But I just need $1,000. I need 1,000 followers on this, right? So hopefully I get to 1,000 followers on YouTube. But this video, let's go straight to the video on what is better or my experiences for being a year and 3 months in from ER versus ICU, right? The ER, I really got a lot of experience with placing IVs. I got a lot of experience with seeing critical patients, right, and getting comfortable with that. There's a quick period in like 3 to 4 months where you have anxiety. You're going to feel that if you're a newer nurse, and I just want to let you know that it's more of feeling comfortable, having that anxiety, which is normal to have because you are at risk of hurting someone critically, right? But that experience I had in ED, I loved the ED experience. I would have never left, but I did leave 3 months ago to the ICU. Reason being, I always want to become a CRNA, so I have to get ICU experience for that, right? Adult ICU, not pediatric. They want adult ICU experience. So I'm getting those experience in the ICU. I'm currently in the surgical ICU, doing pretty well up there. I'm almost finished my orientation days out in there. It's really hard. If you're choosing between ER and ICU strictly because you want to become a nurse your whole career, do not go to ICU. It is really hard. You get to see a lot, you get to learn a lot in ICU the same way you see in the ER, but it's more critical, more able to titrate, more autonomy up there, right? As a nurse, if you want that. So maybe if you want to go to ICU for more autonomy, go to ICU. But it is really, really a lot harder with the patient care, with the family aspect, with the titration, with how sick these people are, right? Yeah, you have 2 people at max, right? But it's still really, really hard. The only reason I would recommend you going to ICU if you need to have that experience for flight nurses or CRNAs or if you want to go back to medical school, maybe, right? Or NPs, you can really be any floor, but really those 2 main ones, if you want to go back to school and they require you have ICU experience, I can understand why you want to become an ICU nurse. Yeah, there's nurses who have 30, 40 years in ICU experience, but I don't know how they do it. It's a lot burdensome. I think people talk about nurses burnout. I think you probably have the highest nursing burnout in ICU. You see death a lot. ICU is not for the weak, okay? And I understand that. I really just went to ICU because I wanted to challenge myself. Not only that, I challenged myself in the ICU world, challenge myself in becoming a CRNA as well. So this channel will also have a journey of how I become a CRNA as well. So there's a lot of stepping stones this YouTube channel will have, from me starting a business, the IV hydration, IV boost, prepping that for life, but also another journey of going back to school and getting a CRNA, another journey of possibly moving to SoCal, San Diego. There's a little trouble with that, right? Of me moving because I'm going to possibly move soon, 2-3 years at most, right? But the reason I haven't made that jump right now is strictly because my YouTube channel is doing well with my cousin. If you're seeing this, you're the real reason why I haven't moved, right? I don't want to move when it's doing so well. It doesn't make sense. why do that, especially when it's starting to do so well. So hopefully you move with me, right? Or you go with me to San Diego, right? But you're still in school, which I understand. You get that done first. I could wait 2 to 3 years, right? I don't know if I could wait 3 years, so 2 years max, right? I could wait, but yeah, that's kind of the plan for this YouTube channel. This kind of a little ER versus ICU with also a update on what this channel is going to go to, from more business to a journey to CRNA school. I just wanted to post because I was becoming a little too inconsistent, and to really do well on this app is to be consistent, and that's what I'm going to do now on. So yeah, the reason why I would say, and going back to this, the reason why I would say ICU is a lot harder because not only, like I said, the death aspect of it, a lot of people do die. And that's a little different from what you learn in school, is that nursing is here to help and save. But people do die, and you learn that in the ER, right? And I learned that, and that it's not really a hard concept because at least we're trying to help someone. But you see a lot of people who are very emotional when it comes to family. You see different family dynamics there. You don't really see in the ER because you have a fast turnout, right? You get a new patient pretty fast. You stabilize and then you move on. While in ICU, you're not really stabilized. You're stabilizing for a longer period. So that's what you kind of got to get used to, is that aspect. And then there's a lot of patient care with a lot less help. You got to take these patients. Obviously, you got to take them a shower. You got to clean them. You got to treat them like a human being. You got to clean after them. You got to make sure if they're on a vent, you have to brush your teeth quite often, every 2 hours at most, so you can prevent pneumonia or prevent any bacteria or infection, right? So these people are really vulnerable, right? And you are in control of their stay. Yes, the doctors are very important in the way that, but we're really, the doctors are obviously important, right? But we're focused on nursing, right? In the ER, you don't have that much patient care, right? Patient relationship is pretty faster pace. Let's say ICU is more critical pace, meaning like, okay, you have a lot to do, a lot of medications, not really giving too much medications in the ER. So that decreases a lot of time you use. Like, I wanted to do another video, but this video is really, this to really introduce the journey I want to have for this YouTube channel. It's going to go from business, like I said, to the journey of me becoming a CRNA. And this would be kind of embarrassing that I don't become a CRNA later in life. But things happen. I understand that. But tops 2 years is what I want to do and become a CRNA. Yeah, because it's just another form of challenging myself. But I'm going to stop dragging this video on. ICU or ER really relates to where you want to go in the path in your life, really. We're not trying to spend too much time in nursing and want to elevate. ICU is probably a good area for you to elevate and really learn a lot and prepare you for school. ER, really there to get that experience, fast-paced, right? If you don't like either, med-surg is fine, right? Med-surg is a fine area. Oncology is another fine area. Labor and delivery, more specialized, so it'll take you a lot longer to start with. But I'll stop dragging it. Please like and comment this video and whatnot. Follow me on Instagram, TikTok. I'm doing well in that. But yeah, that's it. See ya.